ART, depending on what formula you were on throughout history, has a side effect of making people double in size.
Come on.
So it's unfair, is that using this as the example. So
ART
I think
being antiretrovirals, a medication people take for HIV. We have everybody watching, so we just have to. And you said adiposity, which I'm gonna.
I'm Google. Did you not hear me say Google that?
Back to another episode of Keep On Loving Podcast. My name is Javonte Lee Williams. I'm here with my co-host,
Amia Pacheco Branch.
Because Amia knows her name today.
Yes, and this is Philly Keep On Loving.
Well, it's Keep On Loving because this goes out all over the world.
Right, but I usually mess that up too, and I just remembered that's the podcast we were doing.
But you're pretty.
Thank you. Thank you.
Today, who do we have?
We have... And I'm going to listen. This is Evan Thornburg.
yes,
Because I usually call you Thornberry because I...
throw out thornberries.
Yes.
Not to be confused with the wild thornberries.
Or the governor.
Welcome.
The governor
Evan.
of PA is a Thornburg?
A past governor was a Thornburg.
Mm,
I don't know him.
okay, all right.
Just saying.
That's not your cousin.
And we have a studio audience joining us. Can
Clap
we
your
give a
hands,
round of
say
applause for the studio
woo!
audience?
Yes.
It's just three of our coworkers.
It's all right. It's all right. It's all right.
So we have had a time getting over here. Can we talk about that?
Do you want to start with the shade or do you want to talk about getting set up?
All of the above. So one, there's no air conditioning where we're filming.
Oh, God.
So we're hot. So if you see sweat stains, ignore them and come for the content.
Mind your business.
Mind your business.
For all my trans girls, this week was a moan shot. So if you understand what I'm going through
Basically,
right now.
if you point out any sweat stains, you're homophobic, and I just want to
You're
highlight
homophobic.
that.
I agree.
Yes, I like
agree.
that. I agree with that.
And then we're having to fight with these cameras because we're public health people, not technology people.
Get Javonte a intern.
We do need an intern. If you're interested in interning on the Keep On Loving podcast,
Please.
It's a variety of things. There's a woman who is in our TRL window. Those of you at home or listening, you can't see this window, but there's a little peep window, and she keeps cleaning. She has been cleaning the same spot for about a good 20 minutes.
She's on the phone right now. She's wiping, but she's on the phone.
She's trying to call in, but you guys won't
This is
get past
not a
the
call-in
intro.
show. This is not a call-in
She's
show.
trying to call in.
So we brought Evan on the show today because we're going to be talking about equity and health equity. You are our health equity advisor at the Philadelphia Department of Public Health.
Could you put the important title on front? Special. Like this was their title specifically. Special.
Advisor.
Yeah, that's right.
So, but then when we were walking over here, you were wearing a T-shirt that said something about empathy.
I was, until I got too hot and took it off.
And you took off the shirt, yes.
Sorry.
I really like the idea of empathy. What is empathy to you?
So you and I have been working together for 3 years. And in the beginning, when we were first setting up EHE programming, we were starting to really get into
EHE, ending the HIV epidemic.
Yes, that. You had talked about specifically radical customer service, and in health equity, the way we kind of meshed on that concept is the application of dignity, that we built it into the radical customer service model. We've built it into our pillar 0. And so I think empathy takes it a step further, right? Because you can extend dignity to somebody without being empathetic. I think empathy requires extending dignity, but also emotional buy-in.
Yeah. Because I think a lot of people who enter the sexual wellness space struggle with empathy for people who are different than them.
I totally agree with that. I totally agree with that. I know starting off, that was one of my biggest issues to like realize, and somebody had to pull me aside like, yo, like if you're going to stay in this field, like you have to understand that like everybody's different and you may seem a little different to somebody else. Like imagine being on that other side of the seat. So I absolutely agree with that.
Yeah. And I think if you're going to provide services, if you're going to be engaging communities, you have to have a certain level of empathy and understanding. And I was really curious about your shirt because I don't know if you can teach people how to have empathy.
I'm going to push back on that. And the reason why is because I think my mother has this famous saying of people don't know what they don't know. Mm-hmm. And the problem with people who don't know what they don't know is they frequently do my mother's other favorite saying, which is
your mother has a lot of sayings.
She's a Southern lady, so her other saying is "Don't take nothing that don't belong to you," right? Mm-hmm. And I think a lot of times
that's the second time I've heard you say that, and I really love that statement.
She really hammers that home, mainly because I was her child. But I think you can teach people empathy. I just think that it looks what that teaching looks like. I don't think you can just teach it by verbalizing the issue. Mm-hmm. Some people learn through personal narrative. Some mm-hmm. people learn through looking at data and looking at the kind of macros of something. Some people learn through experiential engagement, right? Like they have to be physically in a space and see poverty, or have to physically be in a space and see somebody harmed or hurting. I think it can be taught. I think we're all learning more and more. Mm-hmm. But the question becomes, especially when something's just a job, mm-hmm. how do you teach empathy? I can't force somebody mm-hmm. on a job to go and live amidst a group of people who are marginalized or vulnerable to build up their empathy. So I think it's hard to teach empathy when the way that they learn it mm-hmm. is not a way that you can mandate. Mm-hmm. Does that make sense?
Yeah. And measuring empathy. Mm-hmm. How do I measure how comfortable someone makes me feel, right? On a scale of 1 to 2, when you came in to get your itch taken care of, did you feel like someone appreciated you? Mm-hmm. I don't know how to measure that. And all the ways that we do, I think, don't capture the actual concept of empathy. Mm-hmm. And just making sure that people are delivering quality service, but delivering service in a way that centers a person's lived experience and makes them feel good.
Yeah. I think the first thing starts with throwing away this concept of the perfect patient. I think that's the problem with highly medicalized space is there's, and
what does that even mean?
So one of the things that you see in medical spaces, both with clinicians, but also with people who are ministerial or anybody who works in medical. And this isn't just exclusive to HIV. I will say that too. This problem exists for things like cancer care, right? Mm-hmm. We have moralized certain cancers. We have moralized certain diseases. And that's the first step, right? So there's someone who's a perfect patient, and that perfect patient is someone that we morally can ascribe. They have nothing to do with their diagnosis. And mm-hmm. HIV overall has been hyper-moralized. Mm-hmm. And I think people have become more nuanced in how they moralize it, but they still moralize it, right? Mm-hmm. we have empathy for a woman who comes in, she's 21 years old, and it turns out that her boyfriend was cheating on her and he never got tested. Mm-hmm. We have empathy for that. Mm-hmm. We don't have empathy for a similar woman who comes in, trans or cis, because when we're having this conversation, even gender, we can add mm-hmm. in or relinquish. When we add in that person, but she was having sex for money. Mm-hmm. Now it's her fault, mm-hmm. right? Or mm-hmm. she was having sex for money because she was trying to make money for a substance use disorder. Mm-hmm. Now it's really her fault, right? Mm-hmm. And I think the perfect patient is that first one, right? And we can have empathy for her. We're like, oh, this has disrupted her ability to go to school. This has disrupted her. She was just trying to find love. We can moralize it. Yeah. So I think empathy is being able to say, no matter my moral stance, I can extend dignity and understand that this person is not to be at fault. We're just having human experiences. Mm-hmm. That's the risk we take out here, whether you fall in love or you're getting paid to do it. So that's...
I like that.
Amia, do you have a perfect patient and a person that you moralize?
You know what? I think when I first started, what Evan was saying, that would be my perfect patient. If I seen someone who came in for the first time and they were this their first STD or STI, I would be like, oh, like, oh, but like if I seen you come through the office a couple more times, I'd be like, yo, like, did we not have a conversation about like, I mean, somebody else, or I would hear that they're coming in, I'd be like, well, can somebody else take them? Like, because it's the frustration of like, okay, we just had this conversation, like, why are you not doing all the things that we talked about?
Yeah.
But again, when I was pulled aside and was like, yo, like, what about you? Like, remember where you come from? I was like, so like, I definitely resonated with what you were saying.
I had a friend. Hey, friend.
Yeah, Javante, let me ask you. Javante, have you had any?
Wait, let me tell my story.
Oh, boom.
Because I had a friend who would go to a place that was very popular for people. I mean, it was like a clothing optional type of place, right? And they would do testing there on a weekly basis. And it happened to be on Sundays. And so my friend would be like, let me go to church. And his church service was getting tested. Sometimes he had something, sometimes he didn't. But in my mind, even though this was my friend, I can't discard the fact that I did judge in a small moment, right? Like when he told me that story, and it was just like, what kind of skills do we need to develop to be more empathetic to people who we feel like do it to themselves?
I think that's where that motivational interviewing comes in. Like, if
What is
you were,
motivational interviewing?
so I think that has a huge component of empathy in it. Is where you're like, you're listening, you're not judging, you're in that space with that person. You're not giving out any information. You're just taking what they're saying, and you're leaving space for them to speak, and just being able to kind of like navigate them. I think that is one big thing that we can also take away from that, is just sitting and listening. Put yourself in that place, because though you may not be the person who consistently is having multiple sex partners, you could be that person who consistently has a plethora of porn. You know, like there's no for me, there's no difference. Yeah. So being able to like sit and be able to kind of meet them in the middle of like, hey, this is where I've come from, and like, how can I compare that to understand? Like, and that's a lot of times what I do. Like, I may not be able to understand what you're saying for that particular thing that you're going through, but I try to see like, okay, I remember I've been through something similar, or I can compare this to this, to kind of make me be like, okay, like we're on the same playground. For me, I have to, for my empathy, I kind of sometimes have to be on the same playground as you to understand what you're going through.
Yeah. Yeah. What's that thought?
I didn't have it. I was listening. Yeah.
You said, and I was like, wait, what's that thought? Back to, like, I'm really curious, because there's a lot of health professionals, even though this podcast is for everybody, particularly people who are interested in conversations about sexual wellness. But there are a lot of people who work in the field, and they're wondering, is like, that's me. Like, I judge my clients. I judge my patients. What tips might you give them to be more empathetic?
I think I always say this, and I've been an adult a long time now, so I can't keep saying like as a new adult. I can't keep doing that. But one of the things that and maybe this is, I don't know what this is relational to, but I really see, and I've really struggled with in adulthood, is adults not wanting to learn. And I just don't know what this, and they're willing to learn if they're like in a formulaic space, like they're like, I signed up for grad school, but they don't want to learn on their own. And the world is an adventure, and we really need to be learning on our own. And I don't care what that looks like. I'm not going to sit here and be like, it's only book readers that would be able to pick it up, but like, you can watch 3-minute YouTube videos and be given a new thought. So I just really want people to endeavor to learn more about others. People are
scared of that.
But I also think that, like, I think the other thing that comes with empathy is also recognizing when you feel like the ick, right? Like, I think that's like a really good, like, to ask yourself, why did I feel the ick in that moment? And as we're trying to cut down more and more, I think as society grows, we've become somewhat good at recognizing, like, you know, the humanity of like Black people, right? Like we don't have to really argue that on a grand scale anymore, but we still have to argue the value of like fat people, for example. And you can't, and then these things are medicalized, right? Like they are, and I think a lot of times for clinicians and administrators in clinical spaces, they feel confident in their ick when it feels relational to medicine or relational to like
and their
healthcare
expertise.
and their expertise, right? Because your expertise might be a little dated, right? Because we're only just now exploring the science of adiposity, right? We're not having this conversation in this way. And you're not layering it. You have to layer it. Like maybe you're seeing quite a few fat people because ART, depending on what formula you were on throughout history, has a side effect of making people double in size.
Come on.
So it's unfair, you know, is that using this as the example. So
ART
I think,
being antiretrovirals, a medication people take for HIV. We have everybody watching, so we just have to. And you said adiposity, which I'm
Google. Like did you not hear me say Google that?
I just had a presentation on it. So
I'm thinking adiposity means the study or the relationship to fat and fat
it's
cells.
the study of how fat accumulates. Adiposity is the fancy medical term for fat deposit. But it's
or here.
When you see someone who is fat, when you see fatness on someone, that is called I think it's subcutaneous. I think that's what it's called. But it's also the least affecting your health. And so why are you getting the ick? It's because you were taught fat is bad for health, period. Right? But everything has nuance. So I think if we're going to teach somebody or we're going to encourage somebody to build empathy, the first thing you have to acknowledge is everything on this planet has nuance. There's no singular color blue. There's cerulean, there's teal, there's you have to let things have shades. Everything.
I'm just like, as we're thinking and we keep talking about empathy, the thing that just popped in my head, so I was catching the train like last week, and this lady called the security on two homeless people. They were like getting stuff out of their bags and trying to get like their stuff packed up. And she's just like, there's no seats. Like, I can't sit down because your stuff is sitting right here. And I'm like walking down. And the first thing I hear the guy say is, just hope you don't ever end up here. Do you think I want to be here? And then the other guy says, do you think I want to be a drug addict? I was in a car accident 2 years ago, and the prescriptions has led me here. Do you think this is what I want to do? And I'm like, in my long time, I have never seen someone who is housing insecure step up and like really buck back at that. Like a lot of times, you'll hear somebody say when someone asks for change, get a job. But I remember being that person who didn't have $2 and the bus was coming and I needed $2. Like, am I now the same person that I have to get a job? Because I have a job. I just don't have $2 on me. Like, can someone help me, please?
But even extending it further, the fact that you might have a job or you might not have a job, but because you're clean, because you figured out a way to stay clean, you deserve empathy, but somebody else doesn't. You know what I mean? And I think that's just like,
I'm a pushback on the usage of clean, but I know what you mean.
Like,
I know what you mean.
Like what we interpret as somebody being, you know,
sober.
No. I mean, clean as in like physically, like your hygiene.
You mean I washed today?
Yeah, like that.
I thought you were saying I don't do drugs or
No,
I don't have HIV. You mean physically clean?
Yes.
Like there's no funk, no dirt.
If I go into a clinic right now and I smell like 3 days of not having bathed or a week of not having bathed, how am I going to be treated versus someone who has the same dire circumstances but just happened to get a shower the day before? And that. And
you said the day before. You didn't even say the morning of.
Right. Because the way that people have to, the complexity of poverty, for example, makes getting a shower an entire day's endeavor. That's a labor.
Yeah.
I have to figure out which place will let me shower without having to check in, or maybe I don't have an ID. Like, I have to figure out which cousin and how to get to their house. Like, whatever you're doing.
And do they want to let me in?
And I think that's what, in your example with the guy who was, saying, I hope you're never in this situation as me. He was naming the complexity of his scenario, right? He didn't just wake up one day and like not do work or not show up to work. He was on his way to work or on his way to his, somebody giving birth to his child or whatever he was doing, and was in a car accident. That car accident led him to needing pain relief. That pain relief led him to seeking out other methods because maybe he didn't have the right insurance, or he didn't have the right PCP, or he didn't get the right care. There's a clinic and intervention right there. Because of that, he was unable to be stable at work. Because of that, he was let go. Like, he's naming the nuance. And
you better preach.
It's important.
The sermon.
It's not. People aren't just poor. People aren't just fat. People aren't just, it's like there's a lot to it. So knowing just acknowledging that the world is so, it's like that Dr. Seuss book, Horton Hears a Who. And there's a whole world on a fluff. That is the world.
I have always, so I think two things. The first thing is, I think what's dawned on me in this conversation is that people sometimes don't have empathy because they're afraid of the other. It's like, it could be me, and that scares me. And on some subconscious level, this is not science backed by the health department, but on some subconscious level, it's this knee-jerk reaction, right, to the other person or to the other, because that could be me. Right?
Well, it's scary to think that something simple could send you there, right? Yeah. And if I can think like, oh, all poor people just don't work, then that makes me feel like I could never experience poverty because I work. But if I know that you could be driving to work out of no fault of your own, be T-boned, have a disc in your back slip, which requires a lot of surgery. You have a bad surgeon because you have bad insurance, which leads you to have to depend on medical, all sorts of pharmaceuticals to even feel like you can sit up in bed. That feels too possible. And that's why people don't want to explore the nuance, right? Because it does make you feel like, oh man, that could be me. And I don't want to feel that.
I always ask, like, and this is the second thing I was going to say, what changed? What happened? Like when you see someone who has a mugshot for being a serial murderer or rapist, or someone, decides to harm themselves or in their life, or someone does something so like off the track that their life was on, what happened, right? Like, because at one point we all come into the world. I don't care what the circumstances of your birth or what type of family you're born into, everyone starts out as a baby. There's no one who's just like, whoop, out comes a 37-year-old, with
briefcase and all, 401k.
Okay, with baggage and emotional damage and trauma. But at some point, you are a baby. You're something that someone said, oh, look at this baby. And then over a process of trauma and emotional experience and ex-boyfriends or ex-girlfriends, right? Or like misplaced wallets and lost jobs and inadequate access to health, lack of education, denied from getting into the school you applied for. These experiences shape who you are. And so none of us are just like walking around as a blank slate. And I think when you start to acknowledge that, that builds empathy for other people.
Yes.
So Kim, before we start to roll out, right?
You got it that time. You feel it coming, don't you?
I do. It was the way you ended it. It was the pastor in the sermon. Before we roll out, I gotta get my last question in, because I always try to get my last question in, and it's always over. So I just felt that like it's the telepathy today. So my last question, which I feel like was going to be my first question, was why public health work?
For empathy?
No, for you.
For me.
It's kind of a story that involves me. A little bit.
A little bit. I dabbled with it. I mean, I always did work. I did advocacy on the other end, I would say. Javante definitely pulled me into the health department.
I knew you when you were a barber.
That's true. What? I had to get through college.
A different episode for a different day.
Yeah. What? Your girl's got hustles on hustles on hustles.
Hustles on hustles. This is what Javante talks to me about every time, having a hustle and hustle and hustle. Okay.
I think because I find people so interesting. When I tell people that I work in public health, but I'm a social scientist, right? Like that's what my background is in. And I think I like public health versus like medicine, because medicine is individualized care. It does have systems that people affect, but like that's a ministerial position. But the reason why people ask me like, why didn't I go to like med school, for example, is because I don't really want to take care of person by person by person. I like looking at the totality of people and saying, how does this group move? How does this group experience this? How do these folks, based on all these microcosmic individualized things, how are they all individualized, but also very similar? I think it's fascinating. And I love both bringing the context of saying like people are individuals, but also people are groups. And it takes such deftness to decide when you want to endeavor those things, right? Like, when do you want to engage with something on an individual level, or your programming should target individual level, and when should your program be blown out? When should it be the population or the group that you're talking to? And I don't know, I just really like I find that fascinating. I find people fascinating. Maybe it's because I was always a very like a lone child. I always was watching the other kids. I was never like,
what
with them.
happened? What choices were made? What educational experiences? That was a great first question.
Well,
At the end.
Well, Javante,
Oh, Mia.
we've come to that time.
We've come to the end of another episode.
Philly Keep On Loving.
This is our fourth episode.
Is it? Wow. Wait till
Evan was on our first.
Yes.
Then we had Dr. Brady.
Boom.
We had Emily.
Boom.
And now we're on 4.
Philly Keep On Loving.
They can't hear you.
Philly Keep On Loving.
And everybody else. No matter how you are loving, keep on loving.
I like that sign off. We're gonna keep that, and then I'm gonna try to figure that out.
Thanks for watching.
Bye. Bye. Bye.